नमस्कार और बहुत-बहुत स्वागत है आप सबका हमारे इस वेबिनार में। मैं प्रियांशु ध्यानी, हेल्थ एंड वेलनेस को कन्वीनर, आप सबका आज मीडिया मंथन भारती कॉलेज की हेल्थ एंड वेलनेस वर्टिकल की ओर से आयोजित इस विशेष वेबिनार में तहे दिल से स्वागत करती हूँ। द टॉपिक ऑफ टुडेज वेबिनार इज माइंड वर्सेस मिथ, बस्टिंग कॉमन मेंटल हेल्थ मिसकंसेप्शंस। मन बनाम मिथ, मानसिक स्वास्थ्य से जुड़ी आम भ्रांतियों का निवारण। Let me begin by introducing the organization that shaped this initiative, Media Manthan. Media Manthan Bharati College is a student-driven platform that works with the vision of Bharat Pratham, aiming to bring consciousness towards nation, society, and culture. It not only nurtures media skill among journalism and mass communication students, but also builds them into socially responsible, sensitive, and thoughtful individuals. Now, we are truly honored to welcome pioneer in the field of mental health, someone whose work has touched countless lives over the past 36 years. Please join me in welcoming Dr. Roma Kumar, a senior consultant psychologist at both the Institute of Child Health and Max Hospital, Gurgaon. She is also the co-chairperson psychology at the Institute for Psychiatry and Behavioral Sciences at Sir Gangaram Hospital. Dr. Kumar is the founder of Saksham Mental Health and the partner and co-founder of Emotionally, a digital platform providing online therapy and counseling. She also serves as the chief psychologist and wellness advisor of RAFE M5 and the mentor and advisor for Sunshine by License, specifically focusing on child mental health. Her contributions have also been recognized in academics as a distinguished advisor at SSGT University, Faculty of Behavioral Sciences, Gurgaon. Whether it's appearing on national media platform, training professional, or supporting families and children, her impact is truly wide-reaching. Let's put our hands together to warmly welcome Dr. Roma Kumar. It's a privilege to have you with us today. अब मैं मिलवाना चाहती हूँ मीडिया मंथन से जुड़े एक युवा व्यक्तित्व अभिषेक तिवारी जी से। अभिषेक तिवारी जी ने रामलाल आनंद कॉलेज से पत्रकारिता की पढ़ाई की है। वह अभी मीडिया मंथन की स्टेट टीम का काम देख रहे हैं। आप अलग-अलग कॉलेजों और छात्रों से जुड़ने का अहम काम देखते हैं। आप पांचजन्य में रिपोर्टर के नाते भी काम कर चुके हैं। आप फिलहाल मास कम्युनिकेशन में जामिया मिलिया इस्लामिया से मास्टर्स कर रहे हैं और मीडिया के क्षेत्र में अपनी समझ और अनुभव को और गहरा कर रहे हैं। इसके साथ ही वर्तमान में आप नेशनल बुक ट्रस्ट, मिनिस्ट्री ऑफ एजुकेशन, गवर्नमेंट ऑफ इंडिया में कार्यरत हैं। हम अभिषेक तिवारी जी का भी आज के इस कार्यक्रम में तहे दिल से स्वागत करते हैं। Ma'am, we are truly grateful to have you here with us. We kindly invite you to take over the session and enlighten us with your insight on today's topic.
Good evening, everyone. I hope I'm audible to everyone. Yeah.
Yes, you are.
So thank you for getting me on this platform. And this is the first time that I'm on this platform, and I hope we're able to connect with each other, talking on the issues that you've been wanting to address. And before we begin anything, I think it'll be nice if we check on to how good are today? What is the feel of day? Can you name your feeling like? Are you happy? Are you stressed? Are you a little bored? Or there's something else that you can quickly jot it down on your piece of paper to just tell yourself that how are you feeling today? Because very often we do not even like to address that feeling. Are you feeling positive? Are you feeling negative? Or this is just a natural part of being the way you are today. Many of us don't like to question sometimes, especially when life gets really very overwhelming. And getting overwhelmed is a part of being human. So we do feel happy, we do feel sad, we do feel overwhelmed, However, the truth is that all these emotions are very normal. And despite these emotions being normal, we have to learn how to navigate them, how to deal with these difficult times sometimes, and how during stressful times we are able to define our mental health, our emotional health. So, and also because of these questions that we have ahead, there are lots of myths around mental health.
Ma'am, you are not audible. Let us wait for a while, maybe due to poor network connection. Ma'am is not audible. Ma'am will join again in 2 to 4 minutes. Let us wait for that. Guys, do prepare the questions till that. Ma'am will rejoin again soon.
Can you hear me? Can you see me back?
Yes,
Yes.
ma'am.
Yes, it was a huge storm outside. You probably get to hear it also. Everything just went dark. Absolutely. I'm so sorry about this whole thing. Really sorry. Despite all the efforts. Anyways, this is what happens when we talk about feelings and we talk about are we feeling stressed? Are we getting overwhelmed? And that's exactly what has happened. Suddenly, one gets stressed. But despite all of this, let's come back to the topic that there are myths around mental health and that can stop people from seeking help. So we have to actually take care that we start addressing our own mental and emotional health. Now, sometimes or very often, people talk about that mental health issues are a sign of some kind of a weakness, and that if you're talking about your emotions, or you're talking about you're feeling sad or you're feeling low, that means you're a person who's very weak. But this is not true. Mental health struggles aren't about your weakness or your anything to do with your character flaws. There are many factors which are in the environment. It is within our genetic makeup also, or there are many more stressors that play a role, just as we don't see someone with a cold and a cough or a pain abdomen as somebody who's weak, the physical areas. So mental health is also where we shouldn't see this as a challenge, and this is not where we should see how we define the person in totality, just because the person is struggling with some life event or some mental health issue. And it's very imperative that you start seeking for help as soon as you feel that you are not able to deal with certain conflicts in life. Seeking help is a great sign of being resilient and also being a person with a lot of strength. For many of us, there is immense kind of a cultural pressure also sometimes, from our family, from our friends, or sometimes our own role models, that, you need to work hard, even at the cost of suppressing your own emotions or your emotional struggles. Pushing away these negative thoughts that we keep on having in our mind, it only prolongs the amount of time that someone may deal with any kind of an undiagnosed mental health issue. So, seeking help with all the resources that are available is a very powerful step towards healing yourself. So, it's imperative that let's think of mental health as not a sign of weakness, but addressing it is a sign of being resilient and being also looking forward to your own healing and remaining, uh, getting a lot of strength through yourself. Then there's another myth that goes on around that therapy is only, or psychologists or psychiatrists or shrinks are only for people with some serious mental illness. And how do we not talk about serious mental illness? A lay person will only see it through the media, through the paper media, or through the visual media, through a lot of movies or a lot of shows that you start talking of your mental health means only mental illness. So therapy is only for people with mental illness, which is so very untrue. Therapy is actually beneficial for anyone, not just for a person who has a serious mental health issue, but for everybody. We do, therapists do deal with uh, people who are going through conditions like anxiety, through panic attacks, through compulsive problems, or through depression. But a lot of us find it very difficult to navigate through everyday life because of the daily stressors of life, which could also mean work related stress, it could also be in academic related stress, or it could be through relationships. And also the life that we're leading now, especially after COVID, we're doing a lot of multitasking. We're also doing work from home, we're working from our own places, so we're trying to multitask all the time. So it is very important that we address our issues, address the areas that are problematic for us. And therapy, in many ways, can be compared to like going to a gym. If you keep exercising, if you keep being on the treadmill, and if you're lifting weights frequently, your muscles definitely will be strong. There's resistance, kind of happening. Your muscles are getting built up. While mental health therapy helps the brain kind of shape differently, remold itself, and find a lot of newer uh, pathways to deal with situations, and it becomes a little powerful area which is known as the plasticity of the brain becomes different. Your wiring keeps on happening, a newer wiring happens, and so you have the ability to evolve and evolve continuously, and this increases the brain's capacity to adapt and grow. So that's as far as therapy is an important plays an important part for all of us, and not just for the population who's going through a mental illness. Very often people think that seeking help means that I have to take a lot of medicine, which is not true. Treatment for mental health and emotional health is very individualized. It is not essential that everyone has to be put on medication. So medication can be effective for some and some of the areas, and some areas may not need medications at all, may only need that the person goes through therapy. And if during that period you feel that you need medication, the therapist would definitely advise you to go to see a psychiatrist and think of medication. But making a few lifestyle changes, little bit of mindfulness practices along with therapy changes a lot. And also you start thinking differently, and that's the key to finding the best method to deal with your emotional health issues. And making conversations is very important. So it is not just that anybody who has difficulty with emotions or your mental health, you need medication, right? Then many of us think that, we've had such difficult times maybe earlier in our life, and I was able to manage myself very well. But why is it that I need help now? Earlier I was able to do everything fine. Why now that everybody is asking me to go in for help? So a lot of us during our childhood, uh, we did have challenging times, and we were able to deal with it. We were able to overcome those adverse situations without needing therapy, without needing a help from a doctor. I mean, people like us in those ages grew up without even knowing that a psychologist exists. However, now the evidence definitely shows that stressful situations earlier in life increases the likelihood that someone might experience mental health issues. And in the earlier times, we did have joint family systems. We had somebody or the other who we could talk to. We had lots of people in our house. We could connect to them. We could vent it out, and we could find our own solutions. But now we all live differently. We live in different places. Some of us live without our families. So it's important that we address our emotions in the right time. It is also important to recognize that as we take our physical health very seriously, we also need to take care of our mental health. Mental health and physical health are joint in the sense that mind and body are together. It is not static, right? So instead of we should think of seeking mental health care in the same way, the way we take care of our um, maybe a sprained ankle or pain abdomen or a cold and a cough or a pain in the back, we do go and see a physician. So the sooner we address the problem, which is of emotions, we'll be able to come back to action. And also very important is that we are able to understand how to avoid any emotional injury which can happen, right? I hope I'm able to get across explaining this situation. Talking about mental health, people think that if we talk about mental health, it's going to get worse. I'm really going to feel bad. I will go sink into a hole and I will not be able to move out of it, which is not correct. Having an open conversation around mental health has multifaceted benefits, not just for the people who may struggle with mental health challenges, but also for the community at large. So especially we have such a big platform today that all of you are listening, that hearing others such as our parents or our mentors talking about mental health issues can serve to reduce a lot of stigma. Also, we associate a lot of stigma. For example, if you're in school and if you say that you need to go and see a school counselor, you start thinking, Arey, there's nothing wrong with me, why am I being sent to the school counselor? Or that used to happen sometime back, but now the Gen Z, the younger population, they all come back and say we all have our own therapist, which is such a big change which has happened. That understanding that having a therapist with you will actually help you move forward in life, and we don't need to ignore concerns that keep on bothering us, by just ignoring them or by just putting it under the carpet and not wanting to talk about it is not going to keep that problem away. It's going to keep on erupting back, and will create some kind of a trauma somewhere or the other. So whether sometimes you want to check in with your friend, talk to your friend, or visiting a mental health practitioner, verbalizing emotions is often the first step towards the journey of healing. uh, People who have medications also, start thinking that, am I going to be the same person, or with medication I am going to be completely different, which is completely a false feeling that दवाई खाने से मेरे को कुछ हो जाएगा. कुछ नहीं होगा आपको. There's a little chemical change that has happened, and that chemical is going to get you back. All those hormonal changes are going to make you feel better. So we don't need to worry about the medication. It's not going to change who you are. But the truth is that the medication will actually reduce your symptoms and not change who you are. So it's only the symptom that is going to get changed. And finding the right medication takes time. So psychiatrists also sometimes, change your dosages. They titrate the medication. They change the medication sometimes, and that will help you. But again, I come back to the same statement. It is not essential that each one of us who goes for therapy or who has mental health issues has to go in for uh, medication. It's not essential. So mental health as such is very difficult to define in a single word or a sentence. It is more challenging to express one's emotions if there are cultural or societal norms which do not encourage us to have open expression, and that's what we are struggling with these days. So it's important that an organization like you, where all of you got together, we are aiming at dispelling the myths around mental health, and it will also help break the stigma and create a kind of a culture that encourages all of us to seek support whenever the need is there. uh, Another myth that goes around is that if a person has mental health condition, it means the person has less IQ, less intelligence, which is so untrue. Mental illness, like physical illness, can affect anyone of any age, any culture. It can affect anyone. It is regardless of intelligence, it is regardless of the social class that you belong to, it is regardless to the income level. Anyone can have a mental health issue. It is not related to whether you're a weak person or not, you have a weak character. No, this is something that is happening within you, and we need to address it. uh, so having difficulty with your emotions, especially when you're a teenager or you're a young adult, it does not mean that it's a huge issue. You may have some mood swings caused by some hormonal fluctuations or some chemical changes, or you're probably thinking that you are going to take in some substance and your mental health will get better. And when I talk of substances, maybe you are using some nicotine or some other substance to make yourself feel better, and you feel that my mental health is going to get addressed. It is not going to get addressed. It is something, again, that you need to understand, that the mood swings that happen are normal to each one of us. Only if the mood swing goes away and makes us dysfunctional do we need to address it. It does not mean that you have a huge mental health problem. But people who have this mood swing over a longer period of time will have some mental health problem. So it's imperative that we go and address this, talk to people about it. Otherwise, when we keep on thinking around it, we're not going to be able to get the solution. So usually mental health conditions, during the teenage periods, because of the chemical changes, start showing different kind of characteristics. uh, so there's another myth that is there, which is nothing can be done to protect people from developing mental health conditions, which is so untrue. Many factors are there which can protect so many of us from developing mental health conditions.
Maybe again due to poor network, ma'am is not audible. She will start again in few minutes. You all can prepare the question, whether it's related to relationship, past, trauma, family, anything you can ask to ma'am. So kindly prepare the question. She will be joining soon. Maybe due to poor network, she is unable to join. She will be joining soon. Kindly prepare the questions.
This never happens. I don't know what media manthan has done to me today that I'm myself getting so stressed here. It never happens like this. And of course, I am doing this online from Gurgaon, and it never happens over here. You see outside, it's totally gone dark. Everything is dark outside. So I'm really sorry about it. Are you guys having some conversations amongst yourselves to understand what really is happening with the emotional health issues, or there are some issues that you really want to discuss with me beyond what I'm talking? You want me to add on some more things? I'm ready to do that. No problems with that. So I think what is important is also to address uh, that the support that we're looking at, that should happen as soon as possible. We must have a supportive school environment, we must have healthy eating habits, we must have healthy sleep patterns. And this is what is the ability to overcome adversity relies on a combination of a lot of protective factors which we all have. It is not just the environment nor just the individual stressors alone will necessarily help help us with the mental health problems. So children and adolescents who also face adversity typically have some amount of biological resistance to it, as well as they are having strong supportive relationships with family, friends, and adults around them. So, this results in a combination of protective factors to support well being. So it's important to have good sleep patterns. Unfortunately, the youth these days, I think a lot of the younger generations sleeps very late. And so your sleep habit, the biological clock is affected. You have different difficult eating patterns where this also affects with our own nutrition. So all of these factors together also, lead to a lot of emotional health and mental health issues, and lead to a lot of mood swings that are there these days. A mental health condition has nothing to do being doing with being weak or lacking willpower. That's another word that we use, willpower नहीं है उसमें, बहुत weakness है, अगर रो रहे हैं तो बहुत weak है. It is nothing to do with weakness or low willpower. We all express our difficulties, our challenges differently. We all are different. We cannot have the same kind of the coping mechanism like A has versus B having versus C having. In fact, recognizing and the whole fact that you need a mental health expert is a strength. It's a great strength and courage, and anyone can develop a mental health condition. Another area is that young adults or adolescents who get good grades, have a lot of friends, will never have mental health problems, which is so untrue. Because you feel that a young adult or a teenager or an adolescent is doing very well in school, very well in college, is getting grades which are good, is also performing very well on the stage, uh, will have nothing to be going through with depression. Depression is a common mental health condition which results from a complex factors. It's due to a complex interaction of social, psychological, as well as biological factors. So it is not related to whether you are doing very well in school, very well in college. It's not related. It can affect anyone. Depression, anxiety, and all the other things can affect anyone regardless of your socioeconomic level, regardless of how well you appear or your face value is all about. People who are doing very well in school may feel the pressure to succeed, which can cause a lot of anxiety. So some of us have always been in the first five, always a rank holder. So there's a lot of pressure that you have, that you want to be always a person who will be having a rank. They may also experience, so such people might also experience depression and anxiety for no reason and can be easily identified. I hope I'm able to get through to you that these are important areas that I'm talking about. Another area that we want to talk about is sometimes younger children, adults, young adults also talk about that क्योंकि मेरी home की condition खराब थी, as in maybe my parents used to fight a lot, or there was a lot of my parents did comparisons between our siblings, or we had bad parenting, or I lost one of my parents, or my parents have gone through separation. So that is the reason that mental health problems are there. Well, research does talk about it, but it is not essential and mandatory and imperative that a person who goes through this will have mental health conditions. Many factors, which can be poverty, which can be unemployment and exposure to a lot of violence, a lot of shift from one place to another, can also lead to these adverse circumstances and events which will influence the well-being and mental health of all of us. So especially if the caregiver's mental health is not okay, I will get affected. If my grandparents' health is affected over a chronic condition, definitely the family gets affected. If my parent has lost a job, or my parent is going through a medical condition, I will have a problem. You know so children or young adults coming from loving, supporting homes can experience mental health conditions, as can children and young adults coming from homes where you've had some issues. So equally you can have problems. But we need to address these issues, and people who are there, your friend or your teacher or your neighbor, can be the support people, can be your caregivers, and can play an essential role in helping you overcome these problems, whatever problems you are experiencing. So it's important to address them. Uh, we also know that poor mental health, sometimes we think that poor mental health is not a big issue for all of us. You just have mood swings, it's a hormonal fluctuation, And so it is just a way to get attention. So a lot of people think ये तो इसलिए बिहेव कर रही है ऐसे क्योंकि उसको अटेंशन चाहिए, वो ऐसे इसलिए कर रहा है क्योंकि उसको बहुत सारा ध्यान चाहिए, वो जानबूझ के गुस्सा दिखाता है क्योंकि उसको ध्यान चाहिए. You know, we all have moods, but that does not mean that we will not be struggling with mental health, you know. So a lot of us are struggling each day with mental health issues, and that actually creates problems with all of us. So I would like to just say that, you know, many of the myths that are underlying mental health and the treatment of the mental health issues can actually delay each one of us who are going through problems, delay to get help. So it's imperative. The number one thing is to go seek help. And we also have many researchers we are talking about that there are many countries where there used to be young suicides rates was very high. So when the government got in there, especially in South Korea, that they put in phone booths in certain areas, that just before you're thinking that you want to take away your life or you are feeling very, very negative about yourself, there's a phone booth there. You can just go and connect. So the more you delay it, and that time, which is that little time period, you go and talk to someone, that feeling, that deep rooted desire to do something which is negative goes away. So let's try and find methods to be with each other, to listen to each other. The best skill that each one of us needs to have is the listening skill. We may not be able to do much, but we can listen to the person. Let's not get judgmental. We have no idea what that person is going through in his or her home. We have no idea. We just know the little face value of it. If that person is going through stress, be there, because we have the stressors which are, we want to achieve, we want to get the best of jobs, we want to get a lot of money, we want to live in luxury, we want to go party, we want to do so many other things. Everything will fall in place. But if we are struggling with a mental health issue, let's try and address it. Whatever be the answer for how you're feeling, like the question that I began with, how you're feeling, it is important to recognize the emotions as valid as ever, and that seeking help is an act that requires immense strength. It is not easy to go ask for help. It is not a sign of weakness. So never hesitate in asking for help. So I think I would leave it open to you guys to ask me some questions, and I'm going to answer those questions. It's going to be easier for me to connect.
If you have any questions, kindly raise your hand and we will take them one by one.
I think there's Samriddhi Yadav probably.
Good evening, ma'am. My name is Samriddhi Yadav.
Good
Thank
evening.
you so much for your kind words. Ma'am, my question to you is, as you address bad parenting is one of the reason of developing can be a reason for developing mental health issues. Sometimes
No,
some
no, I will correct it. It is not bad parenting, which is a bad reason for mental health condition. You can have some parenting areas which you feel were not right, or maybe you felt, you perceived it was not right. So bad parenting, how do we classify bad parenting? We cannot classify that, right? So maybe there is some home situation which has led us to this behavior. Now you can
yes,
question.
yes, from the situations or the environment which
Yeah.
occurred, and the childrens over there have faced such issues. Sometimes it is not possible for the children to seek help or go to therapies. Sometimes it is not affordable and for not good for their. It is not available also in some places. How can the children over there can seek help, or without seeking help can overcome such issues?
See, nowadays, the educational institutes, most of the educational institute have counselors. So don't hesitate going and getting help. If you're a working professional and you're working in a corporate, you're working in an organization, every organization gives assistance in mental health now, right? Okay. Yes, therapy is expensive, but there's also therapy which is pro bono available. You can always go and talk to them. There are places where you can have chats. There are many apps which are available where you can just go in and put in your query there and you can get that assistance. Even CBSE board during the exams does have those possibilities. Even educational institutes have. But the whole fact is, you can talk to a friend. You can just go talk to someone, take it out of your system, write down some things, and then look for someone. Yes, a lot of parents do not, consider that going to a therapist is a good thing because उनको लगता है कि एक stigma लग जाएगा. But you are educated. You can get help. जब हम बॉयफ्रेंड ढूंढते हैं, गर्लफ्रेंड ढूंढते हैं, तो मम्मी पापा से तो पूछते नहीं है ना. बात तो कर ही लेते हैं ना किसी तरह से. तो इसी तरह से बात करनी है बस. ये नहीं सोचना है कि मेरे को करने नहीं दे रहे हैं, मेरे को हेल्प नहीं दे रहे हैं. हाँ, नहीं दे रहे हैं क्योंकि शायद उनको अभी मालूम नहीं है, उनकी उतनी एजुकेशन नहीं है, उनकी उतनी समझ उन्होंने नहीं देखी है. मेरे जमाने वाले लोगों ने कभी नहीं देखी थी. ठीक है ना. तो इसीलिए आप अपने आप को मत कम सोचो. जस्ट गो हेल्प, गेट हेल्प, एंड द होल प्रोसेस विल इटसेल्फ रिड्यूस अ लॉट ऑफ स्ट्रेस इन यू. Did that answer that question for you?
Yes, ma'am. Thank you so much. Also, ma'am, depression is a very misleaded word which today's generation is taking it as a only problem which they are facing. If they have a bad day or a low day, it is considered to be a depression. How
It
can
is
you
not. हम
classify that?
हम डिप्रेशन को एक तकिया कलाम शब्द ले लेते हैं.
हाँ, वही मैं बोलना चाह रही.
तो हम डिप्रेस नहीं होते, हम सैड हो सकते हैं. सैड होना नॉर्मल है. किसने कह दिया कि हम सैड नहीं हो सकते? किसने कह दिया कि सारे दिन हमारे एक ही जैसे निकलेंगे? किसने कह दिया कि सुबह ऐसे थे अब दोपहर को ऐसे हो गए? हाँ, हो गए. एक्सेप्ट करो. इट्स ओके. इट्स फाइन. इट्स गोना गो अवे. डू सम डीप ब्रीदिंग एक्सरसाइजेस. घर से बाहर निकलो, थोड़ी वॉक कर लो. इफ यू हैव अ पेट, वॉक द पेट अराउंड. Go play, go do something or the other, move away from that place. We can be sad, but we are not depressed. Don't use medical words like this so easily. We are not depressed people. Sad हो सकते हैं, normal है sad होना. आज मेरा मन ठीक नहीं है, हाँ normal है. आज मैं उठी हूँ तो मेरा सर दर्द हो रहा था, हाय पता नहीं क्या हो गया. कुछ नहीं. होते हैं, सर दर्द हो सकता है, दवाई खा लो. आप अपनी कोई शिकंजी पी लो, आप अपने कोई चाय पी लो, कोई कॉफी पी लो, कुछ भी खाओ, लेकिन आपको फील बेटर करना है. आपकी रिस्पॉन्सिबिलिटी टुवर्ड्स योरसेल्फ इज यू योरसेल्फ, नॉट एनीवन एल्स. डोंट वेट कि वो मेरी देखभाल नहीं कर रहे हैं, मैं बोल रही हूँ मेरी बात नहीं सुन रहे हैं. आपको अपनी रिस्पॉन्सिबिलिटी लेनी है. ये सबके साथ हो सकता है कि मेरा दिन आज अच्छा नहीं है. हम कहते हैं ना, आज पता नहीं कौन से साइड से उठे हैं तो हमारा दिन अच्छा नहीं गया. Right? पता नहीं which pillow did I get up, which side did I get up, whose face did I see? We talk of all these superstitious kinds of things. Stop it. Just go do some gardening, fix some meal for yourself, do something or the other. All this feeling of sadness will go away.
Thank you, ma'am.
Okay. Good. You did a good job by picking up the questions, which were great questions. Yeah, there are other people also.
Anushka, you can ask.
Hello, ma'am. My question is that as we also see many students often face continuous pressure from studies, expectations, and life changes. So my question to you is that what are some early signs of stress, burnout, or depression in students that we should be aware of?
There are many things that can be there. If a person is too dependent on substance is very easily available these days, right? It can be nicotine, it can be um, alcohol, it can be various things, right? If that person is dependent, that is the first reason to pick up that that person probably is struggling with something. Second, if the person is having difficulty sleeping, difficulty in eating, getting very angry for no rhyme and reason, with not apparent rhyme and reason, those are the little early signs of picking up that the person has problems. Now, we live in a country which has a large population. You agree with me? It's a large population. The competitive exams are there, but the seats are very limited. So we must have a plan A, B, C, D, and not just depend on a plan A. कि मेरे को तो यही करना है, और ये नहीं मिलेगा तो मेरा पता नहीं क्या हो जाएगा, नहीं। एक प्लान ए है, प्लान बी हो, प्लान सी हो, प्लान डी हो. It's not necessary to do only one thing, right? So yes, there is pressure. Some of it is self created, some of it is created by the environment, some of it is created by my own siblings, some of them from my own friends, from my teachers. So it's a combination of factors. Always have 2-3 things in your pipeline. Not think कि मेरे को तो यूपीएससी ही क्लियर करना है, वो नहीं होगा तो कुछ नहीं हो सकता. I'm just giving a hypothetical example, no? So think of various things that you can do. And now there are so many professions available for each one of us. So many. मेरे जमाने में इन्फ्लुएंसर तो कोई नाम की चीज ही नहीं होती थी. अभी तो जिसको देखो सब इन्फ्लुएंसर है कि नहीं है? फूड क्रिटिक्स ही इतने भरे हुए हैं, इवेंट मैनेजमेंट इतना है, photography has come in such a big way. Is it essential that I have to run for the same degree which everybody is running for? I just have to see what I can do apart from just that 1-2 things. I can do so many more things. Does that answer your question, Anushka?
No.
Yeah. Anybody else? There are more people.
Nana, you can ask.
गुड इवनिंग
Good evening.
नैना मैम, मेरा क्वेश्चन था कि अभी मेरी फ्रेंड का ब्रेकअप हुआ है एंड सेड कि बी अ गुड लिसनर. तो बट स्टिल एक टाइम पे होता है कि शी इज क्राइंग एट मोमेंट, शी सेड आई एम फाइन. सो इतनी मतलब ऐसे ट्रॉमा हम ऐसे कैसे हेल्प कर सकते हैं किसी इंसान की?
पहली बात तो नैना, आजकल के जितने बच्चे हैं, आज हम रिलेशनशिप में, कल हम रिलेशनशिप में नहीं है, फिर आ गए हम वापस रिलेशनशिप में, उसी के पास वापस चले गए. पहले तो हम अपनी इमोशंस को तो समझ लें, हम चाहते क्या हैं. हमने नहीं कहा कि दोस्ती मत करो, हमने नहीं कहा कि कमिटेड रिलेशनशिप नहीं करो, लेकिन अगर ब्रेकअप हो गया है तो हो गया है. आप गुड लिसनर है, अच्छी बात है. उसका रोने का मन कर रहा है, रो लीजिए, लेकिन कहाँ प्रॉब्लम हो रही है, क्या हो रहा है, वो समझना जरूरी है. What has the breakup done to you? What is missing? So that missing, if the breakup has happened, there must be some reason for the breakup to happen. And always, usually the reason is good, because the God is always giving you the right path कि अच्छा टूट गया, सही टाइम पे टूटा है, कुछ सही होगा उसके लिए. तो आपने सुन लिया, आप बहुत अच्छे फ्रेंड हैं, लेकिन उसके साथ में आप उसको अपने इंस्टीट्यूट के थेरेपिस्ट के पास ले जाइए, आप बाहर के थेरेपिस्ट के पास ले जाइए. आप 1-2 बार ही लेके जाएंगे, एटलीस्ट कुछ बोलेगी तो सही वो, अपार्ट फ्रॉम you being a friend. And breakup is normal. It is not that breakup is not normal. Okay, breakup बहुत कॉमन है. और ये जो आजकल रोज है, आज हुकअप हो गया, आज नहीं हो गया, आज उसके साथ हो गया, आज नहीं, आज मैं ऐप पे चली गई, वहां से 4 लोग और मिल गए, सो कैजुअल सेक्स हो गया, आज ये हो गया. इट्स वेरी कॉमन दीज डेज अमंग द यूथ. सो फर्स्ट सी व्हाट डू यू वांट इन योर लाइफ, व्हाट डू यू वांट, व्हाट कीप्स यू हैप्पी. ये जो 2-2 मिनट के इश्क हो जाते हैं ना, वो 2-2 मिनट के इश्क अच्छे नहीं है जीवन के लिए, क्योंकि हम अपने इमोशंस के साथ खिलवाड़ कर रहे हैं. मेरी बातों पे हंसी आएगी, लेकिन मैं सही बोल रही हूँ. जी पूछिए मेरे से.
Kanika, Kanika, you can ask.
गुड इवनिंग मैम, माय नेम इज़ कनिका
Yeah.
एंड मेरा क्वेश्चन है कि अक्सर फैमिली प्रॉब्लम्स जैसे ट्रॉमा एंड प्रॉब्लम्स होती है, उन सब से डर कर हम आगे नहीं बढ़ते, तो इस सिचुएशन में हम क्या कर सकते हैं?
पहली बात तो कनिका, हर फैमिली में प्रॉब्लम होती है, किसी में छोटी होती है, किसी में दिखती है, किसी में नहीं दिखती है, किसी में बड़ी होती है ना. हर फैमिली में, हर रिश्ते में ऊंच नीच आता रहता है. पर क्या हर ऊंच नीच में मुझे बीच में दखल अंदाजी करनी है और मुझे ही उसको ठीक करना? नहीं. मेरे पेरेंट्स, मेरी फैमिली एडल्ट्स हैं, दे हैव टू लर्न टू एड्रेस देयर प्रॉब्लम्स. आई कैन नॉट हेल्प देम. आई कैन बी गुड लिसनर, आई कैन नॉट हेल्प देम. I have to focus on my life to get myself forward, to get myself into a profession. That is an area which is important for me at this point. Are you getting me?
यस
So
मैम.
focus on yourself, be mindful of things. Environment में बहुत कुछ चलता रहेगा. ठीक है ना, एनवायरनमेंट में चल रहा है लेकिन मेरे हाथ में नहीं है. व्हाट इज इन योर कंट्रोल, फोकस ऑन दैट. व्हाट इज नॉट इन योर कंट्रोल, डोंट गो ऑन फोकसिंग दैट.
थैंक यू मैम.
Sadhika, you can ask.
Hello, ma'am.
हेलो साधिका.
Uh, as you said कि feeling sad and clinically उसको depressed कहना is wrong. So can you explain the difference between feeling sad and being clinically depressed?
Very good, Sadhika. That was a very good question. So, a lot of us feel sad, but we come out of it. Every day we come out of it. We don't keep sitting in there with that sadness. But if that sadness has been there for 3 to 6 months and I am unable to function, I am feeling all my areas of life are affected. I'm not eating well, I'm not sleeping well, I'm not focusing, I am I'm having episodes of crying. I'm having so many other things, and that's happening for a longer period of time. That is when we will think of clinical depression versus just being sad. While being sad, I'm functional.
And
Does that make
one more
sense?
question, yeah. One more question I have to ask. Is stress always bad for the mind and body?
There's stress is got eustress and distress. राइट. सो यू स्ट्रेस इज गुड स्ट्रेस. इम्तिहान जाने से पहले थोड़ा बहुत स्ट्रेस होना जरूरी है, तभी हमारी परफॉर्मेंस बहुत अच्छी होगी. अगर बिल्कुल भी कुछ नहीं है तो फिर हमें ही दिक्कत है ना कोई. तो यू स्ट्रेस, ई यू स्ट्रेस इज गुड स्ट्रेस. सो देयर आर मेनी टाइम्स that stress is good. A certain level of stress is always good.
Okay, ma'am. Thank you.
Rishika, you can ask.
Hi, Rishika.
Rishika,
I think somebody else can ask. Shubhangi wants to ask. Who else wants to ask?
Good evening, ma'am.
Good evening.
Ma'am, my question is, even when people know that it's a mental disorder, they still consider it as superstition or religious belief. Like even today in Indian households ऐसा होता है कि अगर अपने पेरेंट्स ने अपने बच्चे में कुछ अनयूजुअल थिंग नोटिस किया है तो वो उसको टेम्पल्स में ले जाना ज़्यादा प्रेफर करते हैं पहले थेरेपिस्ट से. सो वो उस माइंडसेट को हम कैसे चेंज कर सकते हैं?
हम किसी को चेंज नहीं कर सकते बेटा. हम नहीं किसी को चेंज कर सकते. जैसे आप लोगों ने इतना अच्छा एक कोशिश किया, एक प्लेटफॉर्म पे आप लोग बात करने आए हैं, ऐसे ही हम जितनी एजुकेशन करेंगे, जितनी अवेयरनेस क्रिएट करेंगे, उतना ही अच्छा होगा लोगों के लिए. आजकल बहुत सारी संस्थाएं जुड़ गई हैं जहां हम सब बातें करते हैं कि हम नहीं कह रहे कि आप रिलीजियस संस्था पे मत जाइए, आप बिल्कुल जाइए, लेकिन जहां प्रॉब्लम है उसको सॉर्ट आउट करना जरूरी है. अगर मेरे पैर की हड्डी में कोई प्रॉब्लम है तो क्या मैं सुपरस्टिशियस बिलीफ से वो हड्डी ठीक हो जाएगी? नहीं हो सकती. क्यों नहीं हो सकती? क्योंकि मुझे दिख रहा है कि वो नहीं ठीक होगी. मेरे जो इमोशंस है, मेरी जो भावनाएं है मुझे दिख नहीं रही, तो इसका मतलब क्या वो उस तरीके से ठीक हो जाएंगी? नहीं. जरूरी है कि दोनों को स्पेशलिस्ट की जरूरत है. और आपको झगड़ना नहीं है, आपको सीधा अपने इंस्टीट्यूट में जाना है जहां पर अवेलेबल हेल्प है. और बहुत सारे गवर्नमेंट हॉस्पिटल्स में भी साइकोलॉजिस्ट हैं, बैठे होते हैं. यू कैन गो गेट हेल्प, but do not hesitate from that. There are many NGOs where there are psychologists available. Go get help. There are apps which do not charge a lot of money. You can go get help from those apps also. All right, let them do. If they want to do some superstitious belief, it's okay, but you can address it for yourself. Take that responsibility for yourself. Okay, I cannot change anyone. Even I cannot. When you or XYZ comes to me for therapy, I don't change you. I build up the skills for you to change yourself. Are you understanding? That's what therapy is, for you to understand how to change my thought process, because हमने इतने साल लगा दिए इस thought process में रहने के लिए, हम उसी तरह के सोचते हैं, है ना?
Yes, ma'am. Thank you.
Priya, you can ask.
Good evening, ma'am.
Good evening.
My question for you is how can we differentiate between normal stress and a mental health condition that needs professional help?
मैंने अभी शायद समझाया है ये वाली बात प्रिय, अभी कुछ समय पहले ही मैंने सेम चीज बोली है कि अगर आप रोजमर्रा का जीवन आराम से कर रहे हैं, आपको कोई दिक्कत नहीं आ रही है, तो वो एक नॉर्मल स्ट्रेसफुल सिचुएशन है, लेकिन आप लंबे अरसे से नहीं कर पा रहे हैं कुछ, आप प्रोग्रेस नहीं कर पा रहे हैं, आप सो नहीं पा रहे हैं, आप खा नहीं पा रहे हैं, आपको खुशी नहीं किसी चीज से, आपको रोना बहुत आता है, आपको घबराहट रहती है, बहुत सारी और चीजें आती हैं, तो दैट मीन्स दैट पर्सन नीड्स हेल्प and that needs to be addressed. But all of us have sometimes feeling of sadness, sometimes feeling of happy.
But in today's age, everyone faces kind of emotions on daily basis. So how can we differentiate that it is not normal and we need some help, professional help?
आप मेरे को सवाल, आप मुझे एग्जांपल दीजिए, रोज होती हैं भावनाएं, तो पहले भी होती थी, डिप्रेशन होता था, नहीं होता था, भावनाएं तो हमेशा रहती हैं, बचपन से है भावनाएं, कौन सी भावना की बात कर रही हैं? रोज जो भावना, आप बताओ मेरे को, एक एग्जांपल दो.
Like because of our daily schedule, we don't sleep at night mostly, and because of that, the whole day we feel very stressed. We feel that we are tired, but when something is not right with us, these are the only emotions that we face.
So जब हम सोते नहीं हैं, सोना, why is sleep so important? We don't give importance to sleep. 8 to 10 hours of sleep every day is the most important thing for each one of us. It takes away a lot of our stress. It gets in the good chemicals. तो अगर हमारा काम नहीं खत्म हो रहा, इसका मतलब हमें थोड़ा सोचना पड़ेगा कि अपने काम को कैसे स्केड्यूल में लाया जाए, कैसे उसको प्रायोरिटाइज किया जाए, कैसे फोकस लाया जाए अपना, क्यों मुझे अपनी नींद को खराब करना है, क्यों मुझे ऐसा, तो हम अपने बायोलॉजिकल क्लॉक के साथ जब इंटरफेयर करेंगे, तो हमारे जो हार्मोन सिक्रीट होते हैं रात को डीप स्लीप में, हम सब जानते हैं वो अफेक्ट हो रहे हैं ना, तो हमारे सेरोटोनिन लेवल्स सारे अफेक्ट हो रहे हैं, इसीलिए हमें फीलिंग्स ऑफ इनएडिक्वेसी आ जाती है, इसीलिए हमें हर समय कहीं ना कहीं मूड इरप्शंस होते हैं, और हमारी बॉडी पे भी इफेक्ट होता है, इसीलिए हमें ओबेसिटी भी आ जाती है.
Thank you, ma'am.
Priya, you can ask.
Hello, ma'am. My question is, what effect mental health condition can have if it is not treated on time?
So mental health changes its route. It begins probably from anxiety, from lower level of anxiety. If we do not treat it, we do not talk about it, it can go on to panic attacks, it can go on to compulsive behaviors, it can go on to depression, it can go on to affective disorders. So mental health changes its path. It keeps changing. So that is why everybody does not get an illness. If we are having some difficulty, let's get help early on. Let's not wait for an assault to happen. Assault का माने जैसे एक बारी हड्डी में कुछ दर्द हुई है, अगर हम फिजिशियन के पास गए, हमने क्रेप बैंडेज बांध लिया, तो हमने इसको एड्रेस कर दिया. अगर हमने किया ही नहीं, हो सकता माइनर फ्रैक्चर हो, माइनर की जगह कुछ और हो गया. तो इसी तरह से भावनाओं को भी जल्दी हेल्प लेने की जरूरत है, नॉट वेट. तो वेट करेंगे तो हमें फिर और दिक्कत आएगी. और एक और बात बताना चाहती हूँ, जितने साइकोलॉजिस्ट होते हैं, थेरेपिस्ट होते हैं, हम लोग बहुत एथिक्स में फॉलो करते हैं. हम किसी को भी जाके किसी और की बात नहीं बताते हैं. अगर बता दिया तो हमारा अपना सर्टिफिकेशन ले जाते हैं गवर्नमेंट. हम नहीं बता सकते, कोर्ट ऑफ लॉ भी हमसे नहीं पूछ सकता जो हम जाके बता दें. वी आर वेरी क्लियर दैट वी आर, अगर मैं आपको सोशली, आप मेरे को मिल गए, पहली बात तो सोशली मैं आपको याद ही नहीं रखूंगी, आपको लगेगा हम तो गए थे डॉक्टर के पास, इन्होंने तो हमें याद ही नहीं किया। पर वो तो मेरा एक प्रोफेशनल एथिक है, मैं आपको सोशली नहीं आपको मिलूंगी, आप मेरे कमरे में आएंगे मैं आपको याद कर लूंगी वापस। पूछिए, सवाल पूछिए।
Bharati, you can ask. गुड इवनिंग मैम।
गुड इवनिंग।
थैंक यू, जो भी आपने अब तक बताया मैं बिल्कुल उन सब चीज़ों से सहमत हूँ। मैं एक और चीज़ पे चाहूँगी कि आप थोड़े कुछ पॉइंट्स बोलें। एफर्मेशंस डेली बोलना कैसे हमारी मेंटल हेल्थ के लिए अच्छा है?
बहुत बढ़िया सवाल है आपका। इंटेंशंस, मैनिफेस्टिंग, यू आर मैनिफेस्टिंग, राइट? माइंड बिलीव्स व्हाटएवर यू टेल योर माइंड, ये सेंटेंस हमेशा याद रखना। माई माइंड विल बिलीव व्हाटएवर आई टेल माई माइंड। सो अगर मैं अपने दिमाग को रोज कुछ ना कुछ फीड कर रही हूँ, मेरा माइंड उसी को याद रखेगा और मेरा माइंड उसी को बिलीव करेगा। तो अगर मैं रोज अपने माइंड को फीड कर रही हूँ कोई नेगेटिव थॉट, तो मेरा माइंड उसको बिलीव कर लेगा, उसको उसी तरह से रोप इन करेगा थॉट को, ताकि मैं वैलिडेट कर दूं मैंने जो अपने माइंड को बोला है। सो माइंड बिलीव्स व्हाटएवर यू टेल योर माइंड। सो अगर हम मैनिफेस्ट कर रहे हैं, हम बचपन में सिखाया जाता था रोज भगवान का नाम लें, रोज ये बोलें, थैंक यू बोलें, खाना खाने से पहले, मुझे याद है मेरे स्कूल में तो हमेशा प्रेयर होती थी, ग्रैटिट्यूड, काइंडनेस, हम वही बातें कर रहे हैं अभी, काइंडनेस, ग्रैटिट्यूड, है ना? तो हम मैनिफेस्ट ही तो कर रहे हैं, और क्या कर रहे हैं? रोज बोले ताकि हम अपनी कामनेस रखें, माइंडफुल रहें। खाना खाए तो सिर्फ खाने पे ही ध्यान दें, ये नहीं कि फोन भी रखा है, अखबार भी रखा है, टीवी भी चल रहा है, 4 लोगों से बात भी कर रही हूँ, मैं खाना खा रही हूँ, तो मैं खाना एंजॉय नहीं कर सकती, है ना? तो आपको माइंडफुल रहना है, ये मैनिफेस्ट करना जरूरी है, उससे हम काम भी रहेंगे, स्ट्रेस भी कम रहेगा। जी पूछिए।
Ritika, you can ask.
Good evening, ma'am.
गुड इवनिंग।
Ritika this side.
यस रितिका।
मैम मुझे क्वेश्चन पूछना था कि मेनली हमें कहीं ना कहीं ऐसे लोग मिल जाते हैं जो खुद के ऊपर ना बहुत ज्यादा, मतलब क्या कहते हैं उनसे, कि वो उनको ऐसा रहता है कि ये मुझे इग्नोर कर रहे हैं, मुझसे कोई बात नहीं करता, ये वो। बट कुछ टाइम वैसे करते हैं कि सब मुझे पॉइंट आउट कर रहे हैं, ये वो। हम उनसे जितना भी दूर रहने की कोशिश करें फिर भी दूर नहीं रह पाते, वो हमारे पास ही घूमते रहते हैं, वो हमें रियलाइज करवाते हैं कि हम कितने गलत हैं। तो हम ऐसे क्या करें सिचुएशन को हैंडल?
आपने तो जवाब खुद ही दे दिया, आपको रहने की जरूरत ही नहीं उनके पास, आपने तो जवाब दे दिया था। आप देखो, हमारे दिमाग में ये पहले जरूरी है, क्या मुझे इस इंसान से हैप्पीनेस आ रही है, कुछ कुछ मिल रहा है मेरे को, या मेरे को स्ट्रेस ही मिल रहा है इससे? इफ आई एम गेटिंग सो स्ट्रेस्ड एंड ऑल द टाइम गेटिंग ओवरवेल्म्ड बाय दिस पर्सन, why is it essential that I need to be with that person? It's not essential. It's my choice. It's my life. It's my rules. I will make choices. So I will move away. And whatever that person is saying, I don't have to answer back. I just have to hear and probably make some excuse and move away from that person. Because I am directly responsible for my own mood, for my own happiness. I am responsible. Nobody else is responsible. मेरी जिंदगी की कोई भी सिचुएशन ऐसी रहे, लेकिन मैं खुद जिम्मेदारी लूंगी अपने खुश रहने के लिए। वही सबसे बड़ा मूल मंत्र है।
थैंक यू मैम।
Vidya?
Good evening, ma'am. So, you mentioned psychologists and psychiatrists throughout this session. So, I wanted to know what is the basic difference between them, because they both cater to our mental health. So, what is the difference between them?
Very good, Vidya. That's a good question. Psychiatrists go through MBBS degree. Like any other person, an MBBS degree and maybe a 2-year or a 3-year degree in the field of mental health. Psychologist has to do minimum 8 to 10 years of study in mental health, but will not give medication. Psychiatrists will prescribe medication. Psychologists do not prescribe medication. वी आर वेल ट्रेन्ड इन साइकोफार्माकोलॉजी, मतलब हमें दवाइयों के बारे में सब मालूम है, लेकिन हम उसको प्रिस्क्राइब नहीं कर सकते हैं। हम थेरेपी करते हैं, हम उन पे एक एक क्लाइंट के ऊपर 40 से 45 मिनट 1 घंटा बैठते हैं। साइकियाट्रिस्ट इतने घंटे नहीं देता है, वो दवाई के ऊपर ज़्यादा फोकस करता है। कुछ साइकियाट्रिस्ट होते हैं जिन्होंने थेरेपी भी सीखी होती है, तो वो थेरेपी भी साथ में दे देते हैं। लेकिन कॉग्निटिव बिहेवियर थेरेपी, बहुत तरह की थेरेपीज हैं, एग्जिस्टेंशियल हो गई, नैरेटिव हो गई, डायलेक्टिकल थेरेपी हो गई, वो सब साइकोलॉजिस्ट आर ट्रेन्ड टू गिव दैट थेरेपी। Did that answer that question?
Yes, ma'am. Thank you.
Okay.
अनुष्का,
मैम वन मोर क्वेश्चन आई हैव, जैसे कभी ऐसे स्ट्रेसफुल सिचुएशंस हो जाते हैं, ऐसे कभी इंसिडेंट ऐसा हो जाता है कि इंसान ट्रॉमेटाइज्ड हो जाता है, वो कितनी भी कोशिश कर ले सही होने की, लेकिन वो फिजिकली तो 100% देता है सही होने का, लेकिन वो मेंटली एक ऐसी चीज होती है जो ट्रिगर करता है उसे। तो हाउ कैन वी हील मेंटली लाइक ऐसी सिचुएशंस में?
हर चीज को हम इंडिपेंडेंटली नहीं हैंडल कर सकते हैं, इसीलिए थेरेपिस्ट के पास जाना जरूरी होता है। साइकोलॉजिस्ट ढूंढकर उससे जाकर ये बात करेंगे तो वो अनबायस्ड आपको न्यूट्रल थॉट आपको देगा, किस चीज से आपको परेशानी हो रही है, आपको वो ट्रिगर क्या कर रहा है। क्यों तो मेरे पास कोई आंसर नहीं है, क्यों किसी के पास भी ट्रिगर आ सकता है, कभी भी आ सकता है, लेकिन वो ट्रिगर से मुझे क्या प्रॉब्लम हो रही है। मेरे को जो प्रॉब्लम हो रही होगी, सेम ट्रिगर किसी और को वो प्रॉब्लम शायद ना दे, है ना। तो मुझे क्या हो रहा है, तो उस चीज का हेल्प देने के लिए थेरेपिस्ट आपको हेल्प करेगा। इसीलिए हम थेरेपिस्ट के लिए इतना ज्यादा बोल रहे हैं। हमारी कंट्री में बहुत कम मिनिमलिस्टिक थेरेपिस्ट हैं अभी। हमारी पॉपुलेशन इतनी लार्ज है और इतना डेफिसिट है हमारे पास थेरेपिस्ट का, तो इसलिए जो मिलता है उससे बात कर लिया करो, ठीक है। और थेरेपिस्ट आपको हिप्नोटाइज नहीं करता, कोई नहीं करता, सिर्फ आपकी बात सुनते हैं।
थैंक यू।
समृद्धि।
मैम एक क्वेश्चन और है, अगर जैसे कभी हमारे सामने कोई बच्चे हैं जिनके घर में कुछ भी प्रॉब्लम है, फॉर एग्जाम्पल डिप्रेशन है या कोई ऐसी चीज से वो गुजर रहे हैं, जो 5-10 साल के छोटे छोटे बच्चे होते हैं, हमारे घर में सर्वेंट्स भी आते हैं, उनके बच्चे भी कई बार ये सब चीजें फेस करते हैं ड्यू टू एनी प्रॉब्लम उनके घर में, तो उन छोटे बच्चों के लिए हम तो एज ए थेरेपिस्ट कुछ नहीं कर सकते, बट हाउ कैन वी इंडल्ज देम टू सम एक्टिविटीज टू डाइवर्ट देयर माइंड, ताकि वो उस ट्रॉमा से थोड़ा बहुत बाहर बाहर निकल सके, क्योंकि उन छोटे बच्चों के लिए तो थेरेपी बहुत बड़ी चीज होगी अंडरस्टैंड करने के लिए।
कलरिंग करिए, थोड़ी बहुत कलरिंग करिए, थोड़ी बहुत स्केचिंग करिए, खेल खेलिए, लूडो खेलिए, कैरम बोर्ड खेलिए, छुपन छुपाई खेलिए, थोड़े से जैसे नाटक कर लेने, वो जरूरी होते हैं, थोड़े से मैसेज देने वाले रोल प्लेस की तरह वो कर लें, थोड़ा ड्रामा कर लें, हंसी मजाक कर लें, जोक कर लें, भाग लें। That is what is going to help them, that life is beyond all that what they are seeing in their home. So हमें actually नहीं पता किसके घर में क्या हो रहा होता है, जो दिखता है वो सच नहीं होता है।
Okay, thank you.
ठीक है। I'm so happy you guys have asked me such good questions. I really enjoyed talking to all of you, and I hope I was able to pass the message what you wanted. I think Sejal wants to ask me a question.
Ma'am, I wanted to ask what sort of patients do you handle personally and how has it helped them?
तो बहुत बड़ा सवाल है यार, मैं तो 4 घंटे बोल लूंगी इसके ऊपर। सब पहली बात तो जो मेरे पास आते हैं वो पेशेंट नहीं होता है, दे आर ऑल क्लाइंट्स। इन आवर लैंग्वेज वी डू नॉट कॉल देम पेशेंट, वी कॉल देम दे आर क्लाइंट्स, दे हैव कम टू सी अस, कम टू सीक हेल्प फ्रॉम अस। नाउ आई हैव सीन पीपल इन सो मेनी years, a large population, whether it be kids, whether it be teenagers, whether it be young adults or geriatric population also. So most of them come with the general factors that are there are mostly related to relationship issues in all age groups. Second is a lot of anxiety, and especially after COVID, I've seen a lot of anxiety among people. So we listen to people, we give them assistance, and they have I have clients from I don't know how many years who come and go, not necessarily that they have to be all the time there, but they have come and gone, and some of them have their own kids now, and they still come back. So it's a very good feeling that you are able to help somebody. It's a helping profession. You are there to listen to them, you are able to solve things for them. So that's what my job has been. No looking back. I'm happy that I am in this field.
Thank you everyone for your wonderful questions. मन एवं मनुष्याणा कारण बंधो मोक्षयो, अर्थात मनुष्य के बंधन और मोक्ष दोनों का कारण उसका मन होता है. This ancient wisdom reminds us of the profound impact our mind has on our well-being. When misunderstood, it can bind us. When understood, it can liberate us. Now, I would like to invite Jigyasa, the convener of Health and Wellness Media Manthan Bharati team, to deliver the vote of thanks and express our heartfelt gratitude to our esteemed guest, Dr. Roma Kumar, for taking out her valuable time and sharing such meaningful insights with us today.
बहुत बहुत धन्यवाद प्रियांशी. नमस्ते सभी को. मैं जिज्ञासा, मीडिया मंथन की हेल्थ एंड वेलनेस कन्वीनर. सबसे पहले मैं दिल से धन्यवाद करना चाहती हूँ डॉक्टर रोमा कुमार मैम का, जिन्होंने अपना बहुमूल्य समय हमारे इस वेबिनार के लिए निकाला. आपका सेशन बहुत ही तर्कसंगत और खुद में नए बदलाव लाने के लिए भी प्रेरित करता है. मेंटल हेल्थ के संवेदनशील मिथ्स को आपने बहुत ही सरल भाषा में समझाया. आज का ये सेशन हम सभी के लिए बहुत ही लाभकारी रहा और मैं उम्मीद करती हूँ यहाँ मौजूद हर एक व्यक्ति ने आज बहुत कुछ नया सीखा होगा है. आपका बहुत बहुत धन्यवाद हमारे साथ जुड़ने के लिए.
Thank you so much. And I really enjoyed being here with all of you, except for those 2 times when all of this natak happened. I'm so sorry about that. I couldn't help it. Despite the fact I had the hotspot on, I had another thing on, everything was there, but still everything went away. All right. Thank you so much. I really enjoyed. And let's hope we connect somewhere, some more platform again. And me and my team is always there to get any help, any assistance that we can do for anyone. And I've been associated with Bharati College for many, many years now. Okay. Thank you so much.
Dhanyawad Jigyasa ji. Dr. Roma Kumar shared so many meaningful thoughts with us today. Thoughts that deserve to be echoed once again. To reflect on some of those valuable insights and thank everyone who contributed to this session, I now invite Vidya, the co-convener of Media Manthan Bharati College.
Thank you, Priyanshi, for inviting me. Good evening, everyone. I want to begin by extending my sincerest appreciation to Dr. Roma Kumar for her remarkable session today. Topics around mental health have always been shunned and kept aside. But today, her remarks caused us to stop, think, and reconsider our perspective on mental health. This session was not just about sharing information, we debunked myths, countered norms, and made place for a truly genuine discussion. Because let's face it, in today's world, talking about mental health is not a luxury, it's a necessity. And to our wonderful audience, thank you for showing up, engaging, and making this session truly meaningful. Your presence proves that change starts when we choose to listen, learn, and lead with empathy. As we conclude this session, allow me to say one last thing. Waiting for a breakdown to cater to our mental health doesn't work. Choosing awareness, empathy, and active action makes the world around us a better place. Thank you once again.
Thank you.
Excuse me, ma'am. Uh, can we just take a photo of the meeting?
Yeah, sure.
Yeah. So if everyone can just give us a smile and I'll take a screenshot of the meeting. Just a second. Okay, thank you. Thank you, ma'am.
Thank you. Thank you.
यह सत्र एक सिर्फ चर्चा नहीं, यह दिशा थी मानसिक स्वास्थ्य को संवेदनशीलता से समझने की। पत्रकारिता सिर्फ खबर नहीं, सोच को दिशा देने का माध्यम है। आज हमने मिथकों को न केवल पहचाना, बल्कि उन्हें चुनौती भी दी। मीडिया मंथन की ओर से सभी छात्रों का हार्दिक धन्यवाद। आपकी उपस्थिति ने इस सत्र को सार्थक बनाया। चलते चलते बस यही कहूंगी, जब मन स्वस्थ होता है तभी विचार स्वतंत्र होते हैं, और जब विचार स्वतंत्र होते हैं तभी समाज आगे बढ़ता है। धन्यवाद।